Welcome everyone to our LAMP CAA assessment for this is an evaluation of our certified associate acupuncturist aspirants. And we are now on week 6. Congratulations everyone. And I hope you do well today. Okay. Um, let's start with the first question. Okay, yung ating first 5 questions are very simple. There are multiple choice. All you have to do is to choose the correct answer. So ang gusto ko, yung early bird will do the honors of answering all the 5 questions. Let's start with Ma'am Angel. Good evening, Ma'am Angel.
Good evening po, Doc.
Wag na nating i-pronounce yung Chinese name. Just
Apa.
lang 9, no?
Apa. Bali, number 1 po is lang 9 is an shoestring point, Yuan Source point, influential point of the channels, water point of the lang channels, and letter E, all of the above. Ang answer po is all of the above po, Doc.
Okay. I think napag-aralan natin that sa yin channels, yung shoestring point is identical to the Yuan source point. Di ba? You remember? Shoestring is a 5 Shu point. Yan yung third point. Sa yang channel, iba. No? Okay, we call lang 9 as the influential point of the channels because grabe yung impact nito. In fact, it will affect the vessels. And long 9 is the point, is my favorite point. Every time I see a patient na medyo maputla, who has skin issues, at the same time, medyo paus yung boses, no? And when you hold his hand or her hand, medyo malamig. So this is a sign na medyo mahina yung lung chi niya. Okay, I hope that helped. And we call this as the water point on the lung channel because water, as we all know, is the sun of the metal, and lung is metal, no? So in the yin, sa mga yin channels, nag-uumpisa po dyan yung wood, di ba? So wood, so this is the like yeah, so papunta na tayo sa water. So this is the water point on the lung channel. Thank you po, Ma'am Angel. Let's go to number 2.
Number 2, Doc po, is which of the following point is located 2 kun below Chu Chi or lang ay large
LI11.
intestine, large intestine 11.
You pronounce
Ang
it as Tutsun.
okay po, Tuchon po. Noted po, Doc. Bali, ang answer po is letter E. Yung large intestine 10 po ang located po ng Tuchon. Ayan po.
Okay, actually LI10 is a very effective point for people who suffer from shoulder pain. Same side. Okay? This is a technique that I want you to remember. Every time meron kayong pasyente na may shoulder issue, okay, same side, you try to use your probe doon po sa LI10. Okay? Medyo masakit yan. Ako, I make him choose between LI10 and LI12. Okay? So if any of this is painful, usually it's LI10, then that it's the point that you have to need it. It's a distal point for shoulder pain. And for those who are into acupressure, you might want to use this for constipation, no? Bakit pa ganun? Kasi when you have constipation, pag masyadong madaming heat, there will be dryness of the large intestine. So you use LI10. Okay? Yon. And as we know, yung LI10, di ba, ano pa yung last point ng LI, ng large intestine channel? Di ba, it's LI20.
11.
So, papunta sa LI12, LI15, papunta doon sa mukha. Okay? So, for shoulder pain kasi, we use local points. Next, Ma'am Angel.
Doc, number 3 po is large intestine 7 is a letter D po. Xi Cleft point po.
Okay. I think we have learned, pag sinabi mong Xi Cleft, I'm sure expert dito si Sir Michael, no? Minemorize na lahat ng Xi Cleft point. Pag Xi Cleft point kasi, this is the point where the Qi gathers or accumulates. And so, medyo matindi ang impact if you have pain. So, you needle the Xi Cleft point every time there is acute pain. Okay? In fact, one book, I cannot remember the author, sinabi niya, it moderates acute pain. Pinapakalma niya po yung acute pain. So I hope you remember where the LI7 is located. Okay, as you can see, hanapin niyo po muna yung line connecting LI11 and LI5. Can you do it now? Okay, alam niyo naman siguro saan yung LI4. Then, gumawa ka ng guhit, i-connect mo yung LI5 sa LI11, and then from LI5, you count 5 soon. Okay? 5 soon. So, that's your LI7. So, it's very, very good for arm pain, forearm pain, or wrist pain. At the same time, ang dami niya pong uses. Okay? I hope you can find time to watch your video on the Xi Cleft point. Next, Ma'am Angel, number 4.
Number 4, Doc. Which of the following point is the most commonly used for clearing the stomach heat? Bali po number 4 is letter B po. Stomach 44 po.
Okay. I hope everybody remembers kung nasaan yung stomach 44. For those who attended my lecture on acupuncture facelift, you remember where it is? No? It's very good po for stomach heat. Paano ba na natin nalalaman may stomach heat? Masakit yung tiyan niya. There is always this feeling of thirst and gusto nila ng malamig na tubig. Okay? And sometimes, or most of the time, medyo mabaho yung hininga, foul breath. So, you use stomach 44. And also, since heat yan, medyo mapula yung muka. Okay? Yun. Are we clear? And it's also good. Like when you have stomach heat, doon din sa ating lower teeth, masakit. So if you have masakit yung lower teeth mo, you might want to use this point. Okay? Especially pag, lalo na pag hindi mo malaman bakit masakit, wala ka namang bulok ng ngipin, wala ka namang abscess. No? Okay. Number 5, Ma'am Angel.
Doc. Number 5 po is which of the following points is stimulated when dealing with sore throat? Ang answer po is lung 11 po.
Very good. Alam nyo, this is a very, very common point. No? I hope you can use, wag kayong gumamit ng needle na medyo medyo mahaba kasi this is so masakit. I would like to suggest that you order LEPs, ELIPEAS. Super lambot niya. Just message me where you want to order it. It's so good. Or you might want to use a three-pronged needle. You have to cause bleeding. Lung 11 is actually a well point, Jing well point, di ba? Jing well. So it's so good for sore throat. Okay. Thank you very much. Congratulations, Ma'am Angel. You got them all right.
Thank you din po.
Ito po yung lung 11. Between the red and white skin. I hope, Ma'am Ami, you would know how to use this. Just do it fast kasi wag niyong tagalan kasi medyo masakit siya. Okay? Anyway, mas masakit pa kasi yung throat niya. So, just make sure na medyo na-relieve siya right after you needle it. So, the idea here is you bleed it. Mga 2 or 3 drops. Okay? So I hope that helped. Now let's go to part 2. And I would like Ma'am Ami to answer the first 8 questions. Is that okay, Ma'am Ami? Nag-aral ba kayo? Paki-unmute po, Ma'am Ami.
Doc.
Okay, ready?
Inaako lang po yung
Okay. Bawal magkamali ha. So let's read the instructions first. Each question contains a group of options that are followed by a series of questions. For each question, select the answer you consider to be correct. An answer may be chosen several times or not at all. So pwede mo siyang gamitin once or several times. Okay? So para siyang modified matching. Okay? So I hope you studied Shu points. Yung Shu points pala to. Puro Shu points to 1 to 3. So Ma'am Ami, can you do the honors? Ano po yung sagot nyo for number 1? The Jing River, read it?
Okay. Okay, Doc. The Jingle River points are often used to treat the cough, the sore throat, aversion to cold. Letter D, Doc.
Wow, super galing. So actually, aside from well points, actually yung mga books sinasabi, very good ang Jing River. Jing River is the second, di ba? First, ano po yung 5 points, Ma'am Ami? We have the Jing Well, Jing River. What's the third one? The Shu Stream. Then,
Jing River, the sea.
I'm sorry, Jing River is the fourth one. Ying Spring pala. Naku, nasiraan. Okay, number 2 is Ying Spring. Sorry about that, ha? Oo, Ying Spring ang number 2.
Number 2 is Shu Stream.
Yeah.
Yes, Doc.
Number 4,
Number 3.
Jing River. Sorry about that. Medyo kagagaling ko ng isang Zoom. Medyo na ano yung aking utak. Anyway. And the last one is the Husi Point. Yes.
Yes, Doc.
So parang galing sa ano ba to? Sa well, papunta ka na sa dagat. Okay? So
Okay,
your
Doc.
answer is
Letter D.
Jing River points.
And number 2, the Shu Stream points are often used to treat the painful joint caused by exogenous wind and cold.
Okay, very good. So this is very good for people. Usually yung mga medyo may edad na, no? Alam nyo kasi, if you have already kidney deficiency due to old age, medyo masakit na po yung, medyo madali na tayong, we are easily invaded by pathogenic factors like wind and cold and even dampness, no? So the best point to use would be the Shu Stream. Okay, correct. Wala pang mali. Okay,
number 3,
3.
EC points are often used to treat nausea and diarrhea.
Okay. The Hisi points are actually the fifth Shu points, no? Parang sa dagat. Actually, hindi ko masyadong mag-gets bakit ito nausea and diarrhea. Kasi 'di ba, usually pag nilagay mo sa dagat, ito yung parang tubig na tubig, malalim na, 'di ba? Pero I think this is something to do with kasi pag sinabi mong nausea, this is more about rebellious stomach chi, right? Pag medyo nagkamali, like alam naman natin if you have nausea or vomiting, you can probably have issues with your stomach, nagrebelde. And diarrhea naman, on the other hand, is nagkaroon ng problem with the spleen, right? So let's just take it at that. So you just have to remember that the C points are very good for nausea and diarrhea. So a very good example for a C point to deal with diarrhea is Ano ba yung spleen point na nandoon sa ano? Nandoon lang sa may knee point na, no? And also nausea. Okay, whatever. So yun. So Jing River points, the fourth point, these are used to treat cough, sore throat, aversion to cold. So this is basically used for people na medyo may external wind invasion, no? The shoestring points are used to treat painful joints. Ito yung mga medyo may edad na, kung bata-bata pa, wala pa tayong deficiency, we can probably survive. Pero yung mga medyo may ano na. So kaya if you have elderly patients, senior citizens, you might want to use the shoestring, the third point sa yin. Okay? And like kidney tree, no? So the Hisi points are often used to treat nausea and diarrhea. Thank you very much, Ma'am Ami. Can you proceed to numbers 4 to 8? Puro, Five Shu points.
Okay, the Jingwell points of the gallbladder channel is letter C, Doc.
Okay, very good.
Gallbladder port 4.
So this is actually the last point of the gallbladder, di ba?
Yes.
So Jingwell point po yan. Very good. What's your answer for number 5? Puro gallbladder po ito.
Yeah.
Yes, Doc.
Easy. Before you continue, Ma'am Ami, huwag yung isnabin yung gallbladder. Napaka-effective niyan. In fact, I had one patient, medyo naging matakuting na siya, medyo timid na siya. Hindi na siya like, she's only 58, 59. Pero parang, iba na. Sabi niya, madali na siya matakot, ganon. So, nag-iba yung anyo. Ewan ko lang kung she felt a lot better when I needled gallbladder 40.
Calming the spirit.
No, actually, hindi yung ginamit ko, hindi 5 Shu. Gallbladder 40 is the source point of the gallbladder. So marami na tayong alam, no? Okay, Ma'am Ami, can you continue with number 5? Ying spring.
The Ying spring point of the gallbladder is gallbladder 40.
Okay, very good. And shoestring.
The point of gallbladder is gallbladder 41 or letter A.
Okay. Napansin nyo, di ba usually pag shoestring, this is the third point. Do you agree? Except for gallbladder, nasa fourth point po siya. If you start from GB 44, 43, 42, 41. So ito yung exception. Okay? At saka hindi po siya ang Yuan Source. So ang tanong ko, Ma'am Ami, kung hindi identical ang shoestring and Yuan Source po sa Yang channel, like the gallbladder channel, what is the Yuan Source point of the gallbladder? Gallbladder, minention ko kanina. Gallbladder 40.
Tipo.
So, ilocate nyo po yan. Yung mga medyo...
40?
Yeah, very good. Ang galing. I'm so proud of this batch. And thank you for coming early. Alam niyo ba, we're watched by like 34 countries. Kaya, I don't know if they... anyway, I don't think speaking Tagalog would be a problem, no? Because what I think they enjoy watching what is being flashed on the screen, no? But as much as possible, let's speak the universal language. Okay. Number yeah, English. Number 7, Ma'am Ami, you're doing well.
Yeah, Doc. The Jing point gallbladder channel is bladder 38.
Okay, very good.
Letter D.
Gallbladder 38. Yes, congratulations. Okay, next, the Husi point of the gallbladder
EC points of the gallbladder is gallbladder 34 or letter E.
Okay. Huwag niyo pong kalimutan ito sa mga taong nagalit na nagkaroon ng chi stagnation. So try to locate it. I hope all of you have the probe already. Thank you very much, Ma'am Ami, and congratulations for
Thank you,
answering all the 8 questions. Okay, next, I am going to call on Sir Omer na kanina pa ready because I know he's excited. He will answer questions 9 to 14. Okay, so first we are going to talk about, we're going to have 9, 10, 11, 12. Nasa ano pa rin po tayo? Nasa 5 Shu points. Sir Omer, would you like to answer now? Bawal magkamali
The lower easy point of the Sanjiao is sorry, what's this?
So what's your answer?
UB39.
Bladder,
UB39.
urinary bladder 39.
Urinary bladder 39.
Very good. And number 10.
The lower easy point of the stomach is B, stomach 36.
Okay. Congratulations. Dalawa na lang. Large intestine.
Number 11, the lower easy point of the large intestine is letter Shang.
Huwag mo nang i-pronounce, baka mali pa.
Okay. Stomach 37. Okay. And the last one is the lower easy point of the small intestine is C, stomach 39. Letter C set. Stomach 39.
Okay. Where is the location of stomach 37 with regards to stomach 36? How many tsun below stomach 36 is stomach 37? So ngayon, we have learned that stomach 36 is actually the lower husi point of the stomach. And I think as a beginner, you are already experts at locating this. Malalaman natin yan sa practicum, no? So, how many tsun from stomach 36 to stomach 37? It's 3 tsun.
3 tsun, yes.
3 tsun, just right below it.
Yes.
Okay.
Yes.
Next, we go to 13 and 14. Number 13. 13. Alin dito ang Xi Cleft point or points?
Number 13.
Letter C, Doc.
Okay. Anong nagagawa ng lung 6? Remember, ang mga yin Xi Cleft, aside from what's this? Dealing with the pain, it can also help with bleeding. So can you give me one example of a symptom na may bleeding? Katulad ng coughing of blood, no? Hemoptysis, right? Lung 6. Kaya lang medyo lumayo ka konti, baka may TB. Okay? So that's lung 6. What about number 14? Shu point or points include or includes what?
Doc. A, B, and D po.
What about E?
Is included also.
Okay.
Lung 5 is point.
Okay. Sandali lang, Sir Majin, you will have your turn. Sir Omer, nasaan yung can you tell us the 5 Shu points? From like, okay, let's categorize each Sir, are you still there? Sir, Sir Omer, okay. Yung lung 11 is Jingwell, di ba? And lung 10 is Sir Omer, are you still there?
Yeah, I'm still here.
Okay.
Ano po yung ulit po, sir?
Oo, can you name?
Kasi yung ano, yung mahina po yung
Ay, oo. Mukhang nawala ka nga eh. Okay. Di ba may mga 5 shoe points?
Nawawala po kasi.
Oo. So, anong idadagdag natin? Lang 11, di ba?
Fuel.
Anong jingwell ng lang points? Lang?
11.
Yes. And what is lang 10?
Spring.
Okay. What is lang 9? Oh.
Shoestring.
And what is lang
String.
8?
Yung river.
River.
And the C is
Okay.
the C is lang 5. Okay. Next, we're going to call on punta na tayo sa part 3. Okay. This contain, before we start, let's read the instructions first, no? These contain 4 options, lettered A to D, that are followed by 1 or 2 questions. For each question, select the answer that you consider to be correct. Okay. So parang ano din, parang matching din. Yun nga lang, 4 yung options mo. Like, this is called the association type. No? So A, B, then you answer C if it relates to both A and B, D pag neither A nor B. So can we call on Sir Michael? I want you to answer 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay. Sir Michael, kayang-kaya. What's your answer for number 1?
For my answer for my number 1 is I will read first the questions. Number 1 is attribute of blank in the 5 Shu point to the 5 elements. My answer for this one is both shoot stream and easy points.
Okay, can you tell me okay, saan nag-i-start po ang yin shu? Is it the wood or the metal? Wood, di ba? Wood.
Wood to wood, tapos yung
Okay.
sa metal.
So when you talk about shoestring,
Shoestring.
okay, sabi mo it applies to both A and B. So yung
Yes, po.
shoestring sa kahusi, pareho po silang earth. But
Yes,
ang tanong, anong klaseng 5 shoe? Okay. So let's analyze. 'Di ba sa yin nag-uumpisa sa wood? So kung pabaliktad 'yan, let's say so ang wood doon is actually your what?
Large intestine.
The jingwell.
Well, yeah.
So if you go to if it's now the fire, di ba patapos ng wood fire, it will now
Yes.
be the yin spring.
Yung spring.
And then pagdating natin sa earth, it will now be what? Stream.
Yes.
So we're talking about shoe stream for the yin. Now let's talk about the yang. Okay, anong element nag-i-start ang yang points? Metal,
Large
di ba?
Oh, yes.
Metal, right?
Yes.
Okay. So, yung kanyang yung kanyang katabi, the earth, will be the sea. Do you agree?
Yes po.
Okay, so now you understand. So this actually pertains to the Husi points of the Yang channel. I hope that's clear. Let's go to number 2.
Number 2, the attribution of blank in the 5 Shu points to the 5 elements is
Ito masyadong obvious. Water na water.
water na water po ito.
Paano?
5. Opo.
Basta
Letter
lang
B.
mo. Answer is?
Letter B.
Okay. The Husi
Easy.
points. Water
Yeah.
na water. Okay, what about number 3?
The attributions of blank in the 5 Shu points to the 5 elements is metal. So for this one, letter D, neither A nor B.
So, anong points? Let's
Shu
start
stream.
with the yin points.
Ah,
Analyze
you-
natin na, okay, di ba ang yin, always think of yin and yang. So sa yin, saan nagsisimula yung first point? Di ba sa wood?
Wood. Yes.
Okay. So, ang metal will be 2 points away. Okay, okay. Sabi na tayo sa yin. Di ba sa wood nag-umpisa? So si wood is your Jing well. So sino
Yes.
ngayon ang yin spring? It's the fire. Di ba?
Apo.
So
Yeah po,
pagdating natin sa earth, ano na yon? Shu stream.
Shu stream.
Eh ang tanong dito metal. So ano next? Talking about Jing River. Do you agree? Jing River. Wala
Yes
dyan
po.
Jing River points.
Yes.
Okay, let's now go to the Yang. Yang, anong una nag-uumpisa? It's the metal. So ano yon?
Jing well.
Okay,
Jing
very
well.
good. So I hope you got that.
Yes
Okay.
po.
Thank you very much. Hindi ka pa tapos, Sir Mike. 4 and
Yes
5.
po.
Okay, number 4. The channel that... Sige, basahin mo yung question.
The question is the channel that distributed the upper teeth is upper teeth. Is of course the Potiangmen. Potiangmen letter A, the channel
So
of
ano yan?
Potiangmen.
Ano yan? Ano yan? Anong channel yan? Foot Yang Ming.
Is spleen.
Anong spleen? Hindi naman yang ang spleen. That's stomach channel. The channel that distributes to the lower teeth is ano ba? Both A and B or B only?
A only. A only po.
Your number 5?
Number 5. Sorry, number 5. The number 5 is letter V.
So,
Number
the
5.
channel of Han Yang Ming. What channel is that?
It's more on LI liver. Large
Anong
intestine.
liver? Large intestine. So, ibig
Channel.
sabihin, if you want to treat pain in the lower teeth, you use the LI channel.
I
If you
channel.
want to treat pain in the upper teeth, you use the stomach channel.
Channel.
Thank you very much, Sir Michael. Tatawagan ka ulit mamaya. Thank you for answering all of them correctly. Bawal dito magkamali ha. Talagang magbabayad ng 10,000 pag nagkamali. Now let's go now to... Ano yun? Maingay. Okay. Punta naman tayo. I want somebody to answer 6, 7, 8, 9, 10, 11. Ay, 6, 7, 8. 6, 7, 8, 9 muna. 6, 7, 8, 9, 10, 11 na lang. Let's start. Let's call on... Who is ready? Oh, Sir AK.
Yes, Doc.
Ready to Sir AK. Did you study? Bawal magkamali. 10,000. So number 6, what's your answer here? So we have both LI4 and bladder 67. I'm sure you're all familiar.
Correct the position of the fetus. Hindi ko pa na-try to, Doc, pero alam ko to, UB 67.
67.
Opo. I'm not try and practice.
So, hindi mo ini-needle, imomoksa mo lang para
Yes,
ma-correct
Doc.
yung
Yes,
position ng fetus. Alam nyo, like si Sir Majin, di ba, we deal with the rural, yung mga, yung mga hindi masyadong because of their limited means, di ba, Sir Majin? We might want to teach them how to do moksa sa bladder 67. Kasi yung mga, lalo na yung mga preemie, mga first time na mabuntis, hindi masyado sila nagpapa-prenatal. So, para ma-prevent yan, you might want to do moksa. Okay? Kasi pag
Doc,
nagka-breach. So, what's your answer? Number 6?
Number if UB 67, sir, Doc, letter B.
Okay. Now
Letter
let's
B
go
po.
to number 7. Basahin
The
mo
point,
yung question.
the points to which acupuncture cannot be applied during pregnancy is, I think, large intestine 4 and UB 67, Doc. It's both A and B. Letter C, Doc.
Okay. Hindi ka nag-acupuncture sa bladder 67, ha? Moksa lang. Okay? Pag
Yes, Doc.
pregnant. LI4, hindi ka din pwedeng mag-acu. So, I hope that's clear, no? Ito yung
Doc,
direct.
may tanong ako. Yung sa fetus, Doc, ilang weeks na buntis yung bago siya i-moksa?
Kailan ba nakikita sa ultrasound na na una-una, you have to be very good at determining kung nasaan na yung ulo, no? So, it's usually recommended na before maturity ng pregnancy. Okay? So, you need to do it sa 30 weeks. Can you
30
check
weeks,
it? 30 weeks.
Okay.
Onwards. Oo. And kailan ba? Usually 28 nakikita mo na eh. No? So, have you encountered those patients yung mga nagbi-bridge? Kailangan mo to gawin sa both toes for 20 minutes at each point. So, pwede mong gawin at the same time.
20
You need
minutes,
to
Doc.
do this once a day for 10 consecutive days for optimal result. So, pag nawala na yung bridge position niya, you still have to continue the full 10 days. Okay?
Oh. So, almost 20 days.
Yeah.
Thank you, Doc. Thank you, Doc.
So, I hope you can help people here. So, kahit nag-correct na, kasi may tendency pa rin siya bumalik eh. So, usually 28, 30 weeks. Wag naman yung lalabas na, kasi pag ginawa mo siya like 38, yung umiiri na, medyo kailangan mo magpa-CS niyan. Kaya you have to encourage them to really see an OB, obstetrician, no? Marami namang mga health centers na sa mga barangay. So, 20 minutes each time for 10 days, then kailangan may result na, talagang pipit na. Kasi may tendency pang umikot. Okay? So,
So,
definitely...
kailangan, Doc, at least may ultrasound, makita sa ultrasound.
Yes, makita sa ultrasound. So, kung medyo maaga-aga pa, syempre pag 35, 36 na, medyo late na rin. Malaki na yung yung fetus. So, you have to do it like 30 weeks, 28, 30. So, magpa-check talaga. Okay? Next. Hindi ka pa tapos. Number 8 and 9.
The points often selected for treating chronic diarrhea are UB20, liver 13, UB25, and stomach 25. I think, Doc, lahat ito, both A and B, my answer is letter C.
Okay. Can you tell me more about bladder 20? Ano yung classification ni bladder 20? Back Shu point ng?
I think ano Doc ito eh.
Ay, wag, I
Spleen.
think you have to
Spleen to.
be precise.
Spleen Doc.
Oh, wag ka
Spleen.
magsabi ng I think.
Oh.
Kailangan precise. Eh, ang liver 13.
Liver
Di ba
13.
sa harap yung liver 13?
Oh,
Front
Doc, yung
or alarm point
pagdinikit mo yung
ng
ano,
ng
dito sa gilid po, Doc. Sa
Anong
may
sa gilid?
piko, pag dinikit.
Okay, okay. Yung point. So ngayon ang tanong ko, anong classification niya? So kung ang bladder 20 is the box shoe of the spleen, sino si liver 13?
Liver 13.
So dapat spleen din. Siya din yung alarm point or front mu ng
Front mo. Spleen. And stomach.
Anong stomach? Spleen pa rin.
Spleen.
Spleen. Remember that, liver 13. So paano i-locate yung bladder, yung liver 13, Sir AK? Can you tell them?
Dinidikit po, Doc.
Ay,
Kita
wag
niyo, Doc.
yun talaga, okay.
Dito po. Para mas madali.
So,
Ganun ko po siya nilolocate, Doc.
okay. So, kailan mo gagamitin yan? Like, more on acute cases or chronic cases?
Chronic cases, Doc eh.
Okay. I'm really sure, front move. Sino nagturo sa iyo niyan? Or you just presumed? When you
Presume
use
lang, Doc.
front move, you use it for acute cases. Kasi alam nyo,
Okay, Doc.
alam niyo yung yang kasi, yung front kasi, bakit ganito yung mukha ko ngayon? Yung yang kasi, di ba front is yin. So, yung mga yang, ito yung mga acute. So, you use the front move. Yung sa likod naman, yang yan, di ba? Pero yung mga chronic, yan yung mga deficient. So, bladder 20 for chronic issues ng spleen, this is the box shoe of the spleen, while liver 13 is the front move of the spleen. So para masigurado, you needle both for treating. So pero ang question kasi natin, the points often selected for treating chronic diarrhea, anong sagot mo rito?
Si Doc.
So
Both
ibig sabihin,
A and B.
pwede mong gamitin. Siyempre pag chronic, ibig sabihin, may acute, may ano din yan. Kaya isasabay mo na. Diba? Bladder 20 for basically chronic, samantala liver 13 acute. So isabay mo na. No? While letter B, ano pong category, anong classification ni bladder 25? Remember, bladder 25, box shoe of
Back shoe.
of the what?
Back shoe of the stomach. Ano ba to?
No. Stomach is 21.
21.
Large intestine, remember?
Large intestine, Doc.
Okay.
Opo.
What about stomach 25? Front mo ng?
Front mo of the stomach.
No. Large intestine.
Large intestine.
Okay. For issues of the stomach. Anong front mo ng stomach? Anong point? REN 12.
Ren 12.
CV 12. Ano ang front mo ng spleen? Kasasabi lang natin kanina.
13, Doc.
Anong 13?
Liver 13.
Liver 13. Do not be confused. Okay? So, bladder 25 is back shoe of the large intestine, while stomach 25, kahit nasa stomach meridian yan, it's within the realm of the large intestine. Back front mo ng large intestine. Okay?
Okay, Doc.
Okay.
Thank you.
So, what's your answer for number 9?
The points often selected to treat habitual constipation are letter B, Doc. Letter B.
Boy.
UB25 and stomach 25
So,
pinagkasabay.
Okay. Large intestine, di ba?
Large
So,
intestine,
back
Doc.
shoe, pati yung front mo. Okay. Front mo ng large intestine. Thank you very much, Sir AK.
Thank you din, Doc.
Study a little more. Okay.
Yes,
Number
Doc.
10. Let's go now to Sir Majin from Dumaguete. Sir Majin, did you study? Long time no see. Ay, nawala. Anyway, well, let's go to Sir Mark Anthony. Good to see you, Sir Mark.
Yes, Doc. Yes, Doc.
Ay, sige, kayo muna. Can you answer 10, 11, 12?
Ito po nga po, Doc.
12.
Pass muna ako, Doc. Hindi ako nakapag-aral. Ang dami kasing trabaho.
Oo, napansin ko nga, parati ka absent.
Yes,
marami kang
65
aaralin.
year celebration will-culminate this month, and then
Okay.
new transition for the new priest. So, ang dami ko pong ano, pero
Diba, lalagpas ka na sa langit.
Ako dyan.
Okay. Fine time, ha? Alam ko pagod na pagod ka. It's okay, Sir Majin. Let's call on Sir Mark Anthony. Nabuti naman na timing nga na nandito. Sir Mark Anthony, would you like to answer 10, 11, and 12? Walang mic. Please unmute. Ay, unmute ka na eh. Bakit parang mahina? Can you adjust your later? O
Wala
yan.
po akong boses.
Ay,
Nilalagnat ako.
okay. Yung mga walang boses. Anong point ang maganda? Can you tell us, Sir Leo? Naku, ano ba yung pinag-aaralan natin? Hindi ba natin ginagamit man lang? Tinan natin yung tang mo. Mamaya, balikan ka namin. Ano ba yan? Sige, kaya pala walang boses kahit naka-unmute. Sige, okay lang. Let's go to... sino ba? Can I call on Dr. Sam? Buti na timingan nandito si Dr. Sam. Mukhang maaga-aga. Good evening, Dr. Sam. Mukhang busy. Let's call on Ma'am Lane Arandia. Did you study, Ma'am Lane? What is happening? Okay, let's probably...
Hello, Doc.
Okay. Yes, Ma'am Lane, can you answer 10, 11, and 12?
Tatry ko po, Doc, kasi hindi ako masyadong makafocus sa mga babasahin po.
Ay, bakit? Busy?
Yes po. Tatry ko po.
Ito naman kasi, this is something that everyone should know, no? Meron tayong three-edged needle, meron tayong sub-Q. I'm sure you've seen these needles before. This is supposed to be basic, okay? So can you answer number 10? What is your answer po?
Is indicated in treating headache or hypertension. Letters, Doc, both A and B.
So letter C. You can
Yes,
use
po.
both three-edged needles and sub-Q needles. Very good. Okay, what about number 11? Anong gagamitin mo? Three-edged needle, sub-Q. Take note, this is excess, acute lumbar sprain, tonsillitis, excess yan. Ano ba usually ginagawa natin pag excess? Di ba mas effective when we do some procedure? Paduduguin natin o hindi natin paduduguin?
Paduduguin po.
So what is the best modality there? What is the best instrument?
Letter A po.
Okay, very good. O, diba? Okay, Ma'am Lane, this is still for you.
Which of the above regarding the depth of needle insertion are correct? Doc,
Can you read the options?
letter C, Doc.
Your answer is C. So ibig sabihin, when you the deeper you insert the needle, the better the result.
The needle is inserted only deep enough to produce the arrival of Qi.
So what is correct? Both are correct, A and B, or only B?
Letter B, Doc.
Okay, so you change your answer. Very
Yes,
good,
ma'am.
because that is the correct answer. So ibig sabihin, it doesn't matter if you insert, we only insert, wala pong relevance yun, no? Like the deeper you insert the needle, the more effective, no. Because there are, as long as you get that Qi sensation, the arrival of the Qi. Okay? So the
Okay.
correct answer is letter B. Thank you,
B.
Ma'am Lane.
Thank you po.
Kahit po halatang stress na stressed. Okay, let's call on. Can we call on Dr. Sam now? Baka may pasyente pa. Grabe, talagang mga workaholic. Let's now go back to Ma'am Angel.
Hi, Doc. Bali number 13 po.
Okay.
Hello, Doc.
Yes, what is your answer po?
Number 13 po, both reinforcement and reduction needling technique can be applied to letter C po, both A and B, the same patient during one treatment and the same patient over several treatment po.
Kasi may mga cases when you have mixed both excess and deficient, diba? Pag deficient, you do reinforcement. Pag reduction, you do pag excess, you do reduction. For deficiency, you do reinforcement. Okay? Usually we do reduction first, no? Okay, can we continue with number 14 and 15, Ma'am Angel?
Hello. Bali number 14 po, in treating a toothache of the upper teeth, the point selected would be letter D po, neither A nor B po.
So, ano po ang answer? Letter
Ano po? Letter
upper teeth.
Letter D po.
Okay. Ang clue dyan ganito, pag large intestine, lower, LL, no? So, toothache of the lower teeth, the point selected would be
Lower teeth po.
yeah, lower teeth.
Opo. Bali, sagot po ay letter D po. Yung pwede pong LI4 po.
B or
And-
A? Or both?
Po.
Anong sagot nyo sa
Both po, LI4 and hindi, yung LI4 po. Kasi po yung lower po is stomach 44.
Okay, very good. So I hope you remember this. Alam nyo, this is something that will really make the patient remember you. Okay? So, salamat po. Congratulations. Now, let's go to the next one. I would like Sir Omer to answer the first 5 questions. Okay, but before we start, ito po yung instructions. This is actually a favorite. Meron po siyang STEM and 4 options, 1 or more of which may be correct, no? So gamitin natin yung keys. You answer A pag 1, 2, 3 statements are correct. You answer B if 1 and 3 are correct. You answer C if 2 and 4 are correct. Letter D if only 4 is correct. Letter E if all answers 1, 2, 3, and 4 are correct. I think that's easy. Sir Omer, are you ready? Okay na yung signal mo, Sir Omer?
Okay na po.
Very good. Can you give us the answer for number 6?
LI4.
Ano yun? Are you still there?
Yeah.
Bakit ganun yung signal mo?
Rolo po eh.
Huh?
Now, sir, okay na. Oh, you can hear me, sir, Doc.
Okay na, sige, sige. So your answer is, how do you classify Li4? Okay, I want all of you to ask practitioners, give me the classification of Li4. Ano po siya? Is it a Luo connecting point? Is it a Xi Cleft point? Is it a Jing point? Or what's your answer po, Sir Omer? Sir Omer, are you there?
I think that's
Sir Omer? Okay, balikan ka namin mamaya for the next question. Let's call on Sir Leo. Sir Leo, what is Li4?
Sir, Li4 po is a Yuan source point.
Ang galing, talaga naman. Okay. Sa susunod, kasi merong isa dito, hindi pa kayo familiar, yung Luo connecting. Sana po mag-aral kayo next week, ha? Puro points. Ganun po ang mga taga-lab. We just don't say Li4. You have to classify what it is. Is that how they teach you in Okay. Okay, number 2. Lung 7, Sir Leo. Pupusin mo na.
Sir, L7, 1 is Xi Cleft point, 2 Lu connecting, 3 Jing River, 4 confluent point. Sir, Lang 7 is C.
So 2 and 4.
Yes, sir, 2 and 4.
What do you mean?
Lu connecting point and a confluent point.
Okay, what do you mean by a confluent point? So this is something that is connected to an extraordinary organ. Okay? Yan yung mag-open up ng channel. But wala pa tayo doon. But it's good that you answered it correctly. Okay. Number 3, Sir Leo. Ubusin hanggang 10. Okay. Lang 9.
Number 3, Lang 9, 1 Shu stream, 2 Yuan point or Yuan source point, 3 influential point, 4 Lu connecting point. So Lang 9 is A. It is a Shu stream point, a Yuan primary point, and an influential point.
Wow, galing. Aral na aral. Number 4.
Number 4, which of the following points should be punctured with the patient's mouth open? 21st point of the Sanjiao channel, 19th point of the small intestine channel, G2, Tinghui,
Gallbladder 2. Gallbladder 2.
Gallbladder 2, and Jashe.
So what's your answer?
S6.
That's stomach 6.
One,
okay, I'll show you
1,
this
2, 3
one.
din. 1, 2, 3 din, Doc. Letter A.
Okay. 19.
Okay. This is very good for deafness and tinnitus. Okay, so you use, pabuksan mo yung bunganga and you would be able to needle. Pag mahaba ha, 0.5 soon lang. Or 0.3, 0.5. Basta may naramdaman na siya na parang kumuryente, that's it. SJ21, SI19, and gallbladder 2. Okay? So, you use the probe as usual to find out if it's really the point to be needled. Okay?
Bilateral yan, Doc?
Yes, bilateral. Usually, pag
Number
may
5, Doc. Number 5 po.
Oh yeah, number 5. Yeah, up to 10.
Okay po. Sir, the indications of 11 point of the large intestine channel includes A, sore throat, 1, sore throat, 2, motor impairment of the upper extremities, 3, scrofula, 4, for abdominal pain, vomiting, and diarrhea. Doctor, hindi po ako sure dun sa scrofula, pero
Scrofula is
all of the above po. Yung
is
sore
due
throat,
to-
motor impairment, abdominal pain, lahat po yun for LI11.
Kasi pasok yung abdominal pain, so ipapasok mo na yung scrofula.
Okay, sir. Sir,
Okay.
basta alam ko dyan, sir,
So may
excessive.
mga bukol-bukol dahil sa TB, yan ang scrofula. Parang lymph node, ano. Anyway, LI11 is the Hussey point, di ba, ng LI. So it's very good for heat. Di ba?
Yes,
Parang
sir.
masyadong
Excess heat.
mainit, itatapon mo sa C. Sore throat, motor impairment. So this is a parang local point. No, di ba? So parang aalisin mo yung obstruction, scrofula, abdominal pain, vomiting, and diarrhea. Very good. Let's go to number 6.
Number 6. Which of the following points are located 7 tune above the malleolus?
Medial and lateral yan, ha. Hindi lang sinabi medial or lateral kasi ang dami mong points, eh. Meron kang liver, may bladder, may gallbladder. So what are the
Sir.
points?
Sir, pag 6. Sir, itong GB to, no?
Gallbladder po yan.
GB35, GB36, UB58, at saka liver 6.
Yeah, so what's your answer?
Located 7 tune above. Sir, yung malleolus either medial or lateral, right?
Yes.
Medial malleolus, lateral malleolus. Sir, all of the above.
Ang galing. So these are the pictures. This is gallbladder. GB35, GB36. Okay, what do you call this bone?
Sir, saan po, sir?
Yung pinapaligiran ni GB35 and GB36.
Sir, itong sa 35, sir, is the fibula. Yung 36 nasa pagitan ng tibia and fibula.
Ang galing. Bakit ang galing mo? I'm really amazed. Okay. So yan po kaibahan ng GB35 and GB36. And in the future, we're going to study para saan po yung mga points na yan. Okay? And this is bladder 58. 7 soon. Pag bladder 57, I think expert kayo dito, that's 8 soon. Or sa gitna nung no? And then, parang kapamilya niya si bladder 4, stomach 40. Remember? Yes. Dito sa may kabila. And then we have liver 6, which is also 7 soon. Very good. Now let's sige, tapusin mo na number 7.
Which of the following points are located 3 tune above the transverse crease of the wrist? Number 7.
Ganito before you continue, I would like all of you to remember this. Yung mga tune na yan. So you should know lahat ng mga points. Remind me next week, I'm going to send to you the notes. Yung mga pareho silang magka-level sila. Ay nako, it's so useful. Okay? Yon. What's your answer here?
Sanjo 6, Sanjo 7, P5, LI6. Sir, lahat po nasa located above, 3 tune above the transverse crease. All of the above, sir.
So parang tinransfer mo lang yung kanina, di ba?
Opo, sir.
Napansin nyo, instead of the malleolus, this time we deal with the wrist. Can you see the connection? So di ba dito merong magkatabi si 35, GB35 and 36. You see it? Pero it's such 7 tune. Ito naman 3 tune.
Just like going.
Interesting, di ba? So these are the points. So if you notice, TB6 and TB7 magkatabi. Pero yung isa, what do you call that bone? Yung saan yung TB6?
Sir, yung nandun sa may radius.
Radius. And what about TB7?
Sir, sa may gilid ng ulna.
Ang galing. Wow. Kakapanglabot. Okay. What about pericardium 5? What do you call these two muscles?
Ano na ba tawag dito?
Sige, research.
Tendon? Tendon to, sir eh.
Of what?
Palmaris longus yata, sir, if I'm not
Yeah,
mistaken.
galing. Grabe. Okay. What about this? LI6?
Sir, nasa dorsal aspect, sir.
Okay. So,
Opo.
congratulations. Let's go to number 8. Malapit na.
Sir, number 8.
What's your
Sir,
answer?
which of the following points are located 5 tune above the transverse crease of the wrist? So, kung kanina, sir, 3 ngayon, 5, number 8. Sir, LI7 at saka sir, P4 lang.
Pericardium 4. Okay.
Yes,
let's
1 and
take
3
a look.
only, sir. 1 and 3 is B.
Okay. So, sa dorsum, it's LI7. Sa ano, it's, okay. LI7 is what? What is its classification? Xi Cleft, diba? Sige na, wag na. Baka mamaya malito na kayo. PC4, you remember then, I'm sure. Now let's go to number 9. So the answer is letter B, no?
Yes, sir.
LI7 and pericardium 4. Now let's answer number 9.
Sir, ito, pag 0.5, ano yan, sir? Usually mga Jing well points. So, which of the following points are 0.5 con within the hairline? So, number 9, stomach 8, 224.
What do you mean Jing?
Sir. Ay, hairline po pala. Sorry. Akala ko po.
Jingle sa hairline.
Opo. Sorry, sir. Akala ko, sir, 0.5 kun dun sa dulo-dulo. Pagkita ko, sir, puro ST tsaka ano.
Okay.
Ano po? Number 9. Sir, itong GB to, no? GB13.
Gallbladder,
Tapos
yes.
15.
So, ano lang kasama dyan? Like, when you say the hairline, it could be anterior hairline or posterior hairline. So, pakita ko sa yung points. Itong stomach 8. Ito yung 224.
Stomach 8, 224. Sir, yun. Tama yun, sir. Stomach
Okay,
8,
may tanong
224.
ako, Sir Leo.
Yes po.
How do you locate the anterior hairline?
Sir, 3 tune from Yintang.
Wow. From Yintang or the glabella. Okay, very good.
Yes, sir. Yes, sir.
So, kaya malalaman mo kung umusad na yung ano mo, hairline.
Sir, ako,
Okay.
sir, receding na.
Okay. So, basta 0.5 soon. Okay, so this is a challenge lalo na pag wala ng buhok, no? So, you need to locate. Actually, alam nyo, do 24, ang ganda ang feeling sa pasyente. I usually pair it with GB13. So,
Sir,
GB13,
GB13.
you just count, parang align mo lang dito, then medyo malayo-layo pa is your stomach 8. So, ito naman, governing vessel 15 or do 15 is 0.5 tune below the posterior hairline. So, ang tanong ko, ano ang distance between the anterior hairline and the posterior hairline?
7 plus 5. Sir, 12 tune.
Okay, ang galing, grabe. And how do you locate do 20 or governing vessel 20?
Sir, from the anterior hairline, 7 tune. From the posterior hairline, 5.
Ang galing.
5 tune.
Wala ba kayong masabi? Okay, congratulations. Let's go to number. So the answer here po is all 1, 2, and 3, and 4. Very
Opo, sir.
good.
All of them.
Okay, let's go to the last one for you.
Sir, number 10, which of the following points are located 5 tune above the malleolus?
Oh, lateral or medial?
Sir, lateral or medial po to, no? Medial malleolus, lateral medial. 1 is 9th point of the kidney channel. 2, 5th point of the liver channel. 3, 37 point of the gallbladder channel. And 4 is spleen 7.
Okay.
Sir,
What's the
yung
answer?
tatlo lang po, yung first 3, K9, liver 5, and GB37. Letter A.
Okay. This is kidney 9, 5 soon. Okay. This is liver 5, also 5 soon. Tignan niyo yung location, ha? And this is gallbladder 37. 5 soon. Congratulations, Sir Leo.
Thank you po. Thank you po.
Excellent. Now let's call on sino ba? Si Sir Mike, mukhang excited. Sir Michael. Ay, si Ma'am Ami muna. Mukhang nag-aral si Ma'am Ami. Tusok na talaga siya. Needle na needle. Okay, Ma'am Ami, you will answer from 11 to 20. Would that be okay? Okay. Okay, Ma'am Ami, can you read number 11? What's your answer for number 11?
Okay. Makita din.
Ay, hindi mo makita?
Hindi na iba lang po yung posisyon ng ano ko.
Okay. Eh, bakit nabaliktad? Okay.
Yan. Which of the following points are located 3 tune above the malleus?
Malleolus.
Malleolus. Number 1.
What's your answer?
Gallbladder 59. My answer is number 3 is kidney 6 and number 4 is kidney 7. My answer is letter A.
Letter A. Sige,
Yes.
let's take a look. Ito po ang bladder 59. Ang ating landmark is bladder 60. Sa kabila nito is what point, Ma'am Ami? This is the lateral, oh. Ang kabila nito, anong point? Yung sa medial aspect. Di ba kidney 3? Di ba? So sa lateral, it's bladder 60. So from bladder 60, you go up 3 tune, that's bladder 59. Okay? Tapos ito namang si gallbladder 39, from the tip of the lateral malleolus, you count 3 tune. Yan ang GB39. Napaka-effective na point din yan. And also for spleen 6, alam naman natin, spleen 6. So, ibig sabihin, yung counterpart ni gallbladder 39 is spleen 6 sa medial. So, the correct answer is A. Bladder 59, GB39, and spleen 6. Very good. Punta tayo sa number 12.
Which of the following points are contraindicated for both acupuncture and moxibustion?
Hindi pwedeng i-needle, hindi din pwedeng i-moxa.
8. Number my answer is stomach 17.
Okay. What about REN-A? Ano lang pwede natin gawin sa REN-A? Definitely, we cannot needle REN-A.
pwede nating i-moxa. Ang question kasi, contraindicated for both acupuncture and moxibustion. So bakit kaya bawal ang stomach 17? Kasi nasa nipple na po siya. Okay? You don't moxa, you don't needle stomach 17.
Yeah.
Remember that. Lumalabas sa mga questions. Next, Ma'am Ami, let's go to number 13.
Number 13. Which of the following points is used on pregnant women? Number 1 is LI3. Number 2 is LI4. Number 3 is GB6. And number 4 is 6. My answer is letter C.
LI4 and spleen 6. So very easy. Congratulations.
Thank you.
Number 14.
Which of the following statement is are false? The mother point of the lung channel is lung 5. The mother point of large intestine is lung 11. The mother point of small intestine channel is stomach 1. SI1.
SI1, yes.
The mother point of kidney channel is kidney 7.
What's your answer?
Answer is
Ganito ha, I'll explain this. Let's analyze una. So ang tanong dito, which is false? Which is or are false, no? So ganito, ano ba ibig sabihin ng mother point? Like lung channel is what element po? I hope everybody's listening. Metal, di ho ba?
yes, metal po, Doc.
Okay. So, ang mother ng metal sino?
Unang metal is
Earth.
spleen. Yeah, earth.
So, spleen, earth.
Yeah.
So,
Earth.
ano yung earth point ng lung channel?
Ang bali po ang pulse.
Okay, ganito ha. Huwag kayo magpanik. Ganito. Yung lung channel is yin, di ho ba?
Yes, Doc.
So, yung first point ng lung channel, which is lung 11, is wood.
Yes.
Okay. So, wood element. So, hanapin natin ngayon, sino po ang earth element? Ang lung.
Lung 9.
Very good.
Mother.
Nakali na po ito. Do you agree?
Yes.
Number 2, sino ang mother point ni large intestine channel?
Large intestine, Doc.
Di ba si large intestine is yang? Di ho ba?
Yeah.
So,
Yes, Doc.
yung first point niya would be the metal, right? And large intestine is metal.
Yes, Doc.
So,
Tama,
sino
number
ang mother? Wait, nalito na ako tuloy.
Tama,
Sir,
Doc. Mother po intestine ng intestine 11.
So, sino yung... Okay. Yeah, very good.
Tama po siya.
Metal siya. So, yung mother niya is...
Earth.
Yeah, okay.
Tama po ng large intestine 11. Number 3 naman, Doc.
What about number 3?
The mother point of small intestine channel is small intestine 1.
Is that correct?
Small intestine is...
Dapat ang Doc.
Sino sana ang mother point? Sabi mo mali ito. Sino po yung mother point ni small intestine channel?
Small intestine 3.
Okay. So this is wrong.
Well,
What about number 4? The mother point of the kidney channel is kidney 7.
That is correct.
Okay. Congratulations. So your answer is
1 and 3 is false. So letter B.
yun ang false. Okay,
Yeah.
very good. Let's
Thank
go. These are the points. Memorize yun na yan.
Yeah. Masyado daw pero
May idea
ginagawa.
na. Okay.
Kailangan.
Next, let's go to number 15, Ma'am Ami. You're doing great.
Which of the following points are commonly used to cause bleeding? Extra point, which is 1. Number 2 is maxi or extra point. Number 3 is Xing or extra point. And number 4 is Xi Cleft.
So ito yung mga points, ha? This is extra point, upper extremity 11.
Pwedeng
Bibleed mo yan. Actually, maganda yan for stroke. And then, ito po yung baxi, upper extremity 9. And then, ito po yung ating seafoam, upper extremity 10.
Okay.
So, sino hindi kasali? Saan ba si Shampoo?
Sa ano po siya, Doc?
Nakapaligid sa Do 20, di ba?
Opo, sa
Monsoon, sa
alert po
north,
siya.
sa south, sa east, west. Okay. Very good, Ma'am Ami. You've improved a lot. Let's go to number 16. Tapusin nyo na kasi para makapunta na tayo sa basic anatomy. Indications po ng spleen 9.
The indication of, ako pa rin po, Doc.
Opo, hanggang 20.
Indication of spleen 9 are A is extension in the area. Number 2 is suria and edema. Number 3 is ureasis and incontinence of urine. Number 4 is knee.
Answer.
The answer is letter E.
All of the above. Okay, very good. Lahat po
Yeah.
yan, pwede po sa... Ito na yung sinasabi ko kanina na diarrhea, yung ano ba to? Husi point ng spleen. Remember? Okay. Number 17, Ma'am Ami.
Number 17, which of the following were selected capital diseases? 13, number 1. Number 2 is Do 19. Number 3 is 11. Number 4 is 12. My
What's your
is
answer?
answer is letter 3 is the correct answer.
1 and 3.
B.
Okay. Yeah, very good. Pag may fever, unahin niyo yung Do 14. And also I like level. Yung Do 14 is LI 11. So, okay, let's go to 18, Ma'am Ami. Para matapos na.
Which the following statement regarding the sunshine are false? Dito ako medyo may question, Doc.
Okay.
The sun point of liver channel is liver 2. The sun point of spleen channel is spleen 5. The sun point of gallbladder channel is gallbladder 38. And the sun point of the urinary bladder channel is urinary bladder 65.
So what's your
So,
answer? Yung false.
answer, Doc, is all of the 4 is correct.
So walang false?
Walang mali.
Bakit?
Puro po sa sun ng mga channel. Para sa
Analyze muna natin. Pag sinabi mong sun, sino ba yung sun ng liver channel? Sige, punta natin dito. Liver channel is, tingnan natin kung correct si liver 2. Liver 2,
Liver 2.
okay. Di ba si liver channel?
Sun
Yung
of liver
sun niya.
channel.
Okay, yung sun niya would be the, sino bang sun ni liver? Dapat si fire. Anak niya si
Yeah.
fire eh.
Fire po. Yes,
So,
Doc.
yung fire
liver-
is yin spring. So liver 2.
Mm.
Correct si,
Yes,
correct po si number 1.
1. Yes,
Okay.
Doc.
Let's go to the sun point of the spleen channel. Sino si spleen 5? Ang sun is spleen channel. Sino ba? Spleen is earth. 'Di ba?
Po.
So sino yung anak ni earth? 'Di ba si water? Ay, water. Metal.
Metal, Doc.
Metal.
Siya yung sun.
Spleen 5, tama din.
Tama
Yeah,
siya.
Doc.
Okay. Number 3. So correct din si 2. Spleen 5. Sun.
Yes.
Kasi ang ano ng spleen is metal. 'Di ba?
Yes.
Yes,
Anak niya
Doc.
si metal, earth siya. Okay, tama si 2. Number 3, sun point ni gallbladder channel is GB38. Let's take a look. So yung sun ni GB is supposed to be, sino ba sun ng wood? Di ba fire?
Wow.
Tama din to. Fire Jing River.
Fire.
Okay.
Fire Jing River.
Okay. Let's go to number 4. Sun urinary bladder channel is UB65. Sino si UB65?
UB65 is...
Okay. Actually, the question is wrong.
Wood.
Dapat kasi, which of the following statement is true? Lahat po siya
Yeah.
true.
Doc. Yan ako nalito.
Pasensya na, I'm very sorry.
Dapat
Okay.
true po.
I'm sorry ha. I hope that yung mga this is very wrong. Which of the following statements
Yes.
regarding the sun point is true,
True.
not false? I'm so very
Not-
sorry. Yeah. O, at least nag-iisip kayo. O diba?
Diba?
Ayun, so the question is wrong. Very sorry po. Lalo na sa mga taga-subaybay. Very good, Ma'am Ami. At least nakita mo yung budol. Okay. Number 19. Although hindi ako si Dr. Gavin. Okay, number 19. Thank you for that. Yeah, it should be true. Yeah, all are true. Brilliant. Now, let's go to the lower Husi points or Husi points.
Yeah. The lower Hisi include the Hisi points of the triangle channel of the hand. Number 1. Number 2 is the He points of the triangle channel of both hand and foot. Number 3 is the He points of the three both hand and foot. Number 4 is the He points of the triangle channel of the foot. My letter, Doc, my answer is
Letter.
number 4, the He points of the triangle channel.
Wow, galing. Very good. And ito po yung ating lower Husi points. Next, we go to, these are the functions of the Husi. Number 20. Which of the, okay, please read.
Which of the following statement regarding the attributions of the 5 Shu points on Ying channels to the 5 elements are true? Number 1 is the Jing points related to wood. Number 2 is the Hisi points related to water. The Shu stream point related to earth. And the number 4 is the Ying spring points related to fire. Ito yung
Okay.
pinakamadali lang, Doc. All of the above, Doc.
Wow,
or
very good. Ying spring points. Yan ha, mali yung spelling. Maraming salamat, Ma'am Ami. You're so brilliant. Congratulations. Hindi ko na kayo tatawagan. Maraming salamat po.
Thank you, Doc.
Tatawagan ko ngayon yung mga hindi ko pa natawagan. Okay. Now, we have to do this a little fast and I'm sure this is easy for some. Okay, let's call on Sir Omer. Are you ready? Nag-research kayo nito, ha?
Yes, sir.
Assignment. Okay. Anong structure? Okay, can you tell us?
Yes, Doc. Number 1.
Okay, ano yung nakakulay dyan? What do you call that structure, Sir Omer? You're going to take care of, let's see, 5 questions.
Hello.
Sir Omer?
Hello, Doc. Narinig po.
Ay, si Sir Mike pala sumasagot. O sige, Sir Mike. Kayo na.
Hello po. Hello po.
Parang sira yung signal nyo, Sir Omer.
Po ako, Doc.
Sir Omer,
Hello.
yan na ha. Mukhang sira yung internet nyo. Ano ba yan? Okay,
Hello, Doc.
Sir Mike na.
Okay.
Are you
For the
okay?
highlighted,
Wait
Yes,
lang,
for
Sir
the
Mike, we'll call you later. I hope your internet is okay. Sir Omer, take care of the 5 questions. What is this? Yung nakakulay? Is
For me,
it
letter B,
clavicle?
no.
Sir,
Is
it is the sternum.
Sternum.
O sige, sino-sino lang sasagot ha, paunahan, para
Yes,
mabilis
sige,
tayo.
Okay,
Okay.
Doc.
Are you enjoying this so far?
Of
Yes,
course,
sir.
Doc.
Okay, very good. So anong answer po dito?
Sir, sternum, letter B.
Ang
Sternum.
galing.
Manubrium, body, and xiphoid process.
Okay,
Wow.
ito ano to?
Clavicle.
Clavicle.
Clavicle,
Ay, alam na pala nila. Okay, yan.
Pelvis.
pelvis,
Pelvis.
Sige. Yan.
scapula,
Scapula.
Okay. Kailangan nyo tong scapula when we deal with the points of the back, no? The back shoe. We have these models, these mannequins donated by Dr. Webb. Kaya hindi natin makakalimutan si Dr. Webb, di ba? You've seen them. Okay, next. What do you call this one? Yung naka-red.
Humerus.
No, humerus is upper extremity.
Yes.
That's the humerus, sir.
Femur.
Sir, yung sa baba po is femur.
femur,
Sure na, femur. Okay.
femur,
Ito, ano to?
Humerus.
Humerus.
Sir, dun sa medial
Are you sure
part
that's humerus? That's not
Ulna.
humerus.
Ulna.
Ulna. What's the difference between ulna and humerus?
Humerus is on
No,
the
I'm sorry.
upper part.
What's the difference between ulna and radius?
Radius is on the radial side. Ulna is on the medial side with reference to the anatomical
this?
position of the body.
Okay, anong counterpart nito sa paa? Sa leg?
Fibula.
Fibula.
Okay. Next, ano to?
Tibia.
Anong difference ng tibia sa fibula in terms of location?
Tibia.
sa taas ang tibia, upper pit,
Hindi upper. What do you call this upper? That's not tibia.
upper.
Yung naka-red.
Tibia.
Tibia po.
Anong
Yung
difference
nasa-
sa tibia sa fibula?
Yung
Ano yung
Tibia is
medial? Ano yung lateral?
medial is tibia, lateral is fibula.
Galing. Okay, what about this?
Sacrum.
Sacrum.
Sacrum,
Okay. Naka-fuse ang sacrum, di ba? Sacral 1, 2. Okay.
Yung foramina. Very
Sacrum.
good. Ang gagaling nyo, grabe. And this one,
Patella.
Patella.
Patelia.
okay.
Ah,
Sa harap siya o sa likod?
Sa harapan,
Harap.
ano,
Yung nasa likod, anong tawag doon? Anong fossa doon?
cubital,
Popliteal fossa.
popliteal fossa.
Popliteal.
Popliteal fossa.
What about this?
Carpals.
Carpal bones.
Ang gagaling nyo pala, grabe. I'm so inspired. Meron pa tayong anatomy next week, Monday. Okay. This one,
Tarsals.
Dr. Sam, you're not feeling well, you treat yourself. You know how to okay. Ano po ito?
Tarsal
Tarsal
bones.
bones.
Wow, alam nyo na ito.
Gastrocnemius.
Yes.
Gastrocnemius.
Okay. Sure. Okay, very common yan sa mga athletes, no? Gastrocnemius. Okay, what about this?
Gluteus.
Gluteus
Maximus.
muscles.
Ay,
Letter A.
yun na lang pala to sa inyo. And okay, what about this?
Trapezius.
Trapezius.
tissues,
Iskang bright ninyo.
tissues,
Yung iba dyan, bakit ayaw to? Oh, ito. Ito importante to when we locate stomach 9.
Ayan.
CM,
Sternocleidomastoid.
Okay. Bakit tinawag na sternocleidomastoid yan?
It is connected to the sternum and the mastoid process of the skull.
The clido is...
Clavicle.
next and next.
Wow. Wow. Grabe. Marami ng mga teachers. Ikaw, Sir Mike, paano ka rin? Paunahin, okay. Ito ano to?
Antecubital fossa.
Ay, Diyos,
Antecubital.
kaya. Bakit ko pa ba ito tinatanong? Okay, next.
Yan, wala ko yan. Hindi ko alam yan.
Theory fossa.
Axillary fossa.
Yeah. This is important, especially when you locate points there.
Axillary.
Axillary fossa.
Telephone.
Fossa is a depression. And what about this?
Popliteal fossa.
Ang galing. Okay. Now let's go to anatomical positions.
Yan, hindi ko alam.
Okay, can you tell me the relationship between... So kailangan meron siyang meron siyang comparison. Okay. Sino ang superior dito? Si A or si C?
A.
A.
Sino ang inferior? Si J or si C?
J.
G.
Okay. Saan dito yung ipsilateral? B
One
and
side.
E or B and H?
B and
B and E or B and H? What do you mean by ipsilateral?
same side.
Okay. So is it B and E or
B and E.
B
B
and
and
E.
E.
B and E.
Contralateral.
Opposite side.
Okay. B and H.
B and H.
Okay. Galing nyo. Grabe. Okay. Saan dito? Okay, let's talk about medial. Which is medial here? Si F or si E?
In the anatomical landmark, it is F.
Sinong medial? Between F and E, between G and H?
When you talk about anatomical landmark, anatomical position, I mean yung F at saka G do.
And what about lateral?
Yung H at saka E.
Okay. Si proximal, with regards to... Okay, like when do you say proximal? With regards to what?
It is close to the center.
Okay. So, sino dito ang proximal? Si C or si K?
C.
Gagaling. So si distal, si I or si A?
I.
Ay,
Okay.
distal. Mas dulo.
Ay, malapit na tayo matapos. Okay. Gagaling nyo, grabe. Okay. Which is anterior here? M or N?
M.
M.
Which is posterior? P or O? Diyos ko, para naman
P.
tayo grade 1.
Posterior is P.
C.
Okay. With regards to the palm, palm. Saan ang dorsal?
Back
Yung-
of hand.
Backhand.
Sige na, alam nyo na. Okay, let's go to anatomical movements. Or what do you call this? What do you mean? Anong ginagawa ni A?
Flexion.
Flexion?
Yes.
Flexion po.
Flexion.
How do you define flexion?
Decrease the
You bend. You contract the
Okay.
muscle.
Do you increase the angle or? Okay,
Decrease
flexion
the angle.
towards you.
Yes.
Si B, anong ginagawa?
Extension.
Of course. Si C,
Ang arrow, doctor, is
towards.
parang pronation. Kasi towards pronate
Do you
sa
agree?
arrow.
Do you agree, Sir Michael? Towards the arrow? What do you mean by pronation? What do you mean by supination? Or what's the opposite? Like, anong pagkakaiba nila?
Sir, yung pronation,
Hmm.
palabas.
Okay. Like, what do you mean when the patient is supine? And what do you
Nakatihaya.
mean when the patient is prone?
Nakatihaya pag supine.
Pagka po prone, dapa. Pagka supine, nakatihaya.
Diyos ko, alam nyo na, grabe. Nakahiya. Okay. Let's go to letter A. Ano ginagawa ni A? Choose from any of the ones on the left.
Away. Abduction. AB, away.
So from you're actually, anong ginagawa ni thumb? Abducting or adducting?
Dun sa arrow, sir, it is AB, away.
Okay, AB. Very good. Do you agree? Any comment? Okay. Let's go to letter B. Anong ginawa ni B? From out, in.
From out, in, so nag-adduction.
Diyos ko, aral na aral kayo. Grabe. Ang gagaling ninyo. Nakakahiya. Okay. Sige, gawin natin mas next week. Nag-aral talaga. Okay, letter C. Anong ginawa ni C?
Move down.
Anong ginawa ni C? Away from the body.
Sir, yun po yata yung abduct away from the body. So yung A po yata ay flex. Sir, yung A po yata ay extension, ganun ba yun? Basta
Okay, pag
Teka lang.
ano na yun ha. Tanggalin natin yung mga wala dito. What do you mean by plantar flexion? When you say plantar, ano pinag-uusapan? Are we talking about the hand or something else?
foot, sir.
Okay, so walang paa dyan. So tanggalin na natin. So pag sinabi mong dorsiflexion,
Sa foot din, sir. Pataas.
okay.
Pare.
Hindi na alam, grabe. So adduct, what do you mean by
Is-
adduction?
Adduct, sir, towards the center. AD.
From the midline of the body.
Okay, let's go to letter C. Is this rotation or circumduction or none?
Sir, yung arrow kasi niya, sir, parang palayo lang.
Palabas, palayo.
Oo, sir.
So is it
Extension.
Oo, sir. Pwede.
extension?
Extension.
Extension.
Oo,
Okay,
sir.
so letter D,
Opposition. Opposition.
Or
Ay,
flexion.
opposition ba?
yung arrow niya papunta ganun.
Abduction.
Sir, baka siya yung
Adduction.
sir, opposite ng C. So, kung extension yun, flexion yan, sir.
Adduction.
Flexion siya. When you say,
Flexion.
di ba sinabi niyo?
Oo, sir. So, kung yung
Adduction.
C ay extension, flexion yan, sir.
Okay. Do you flex? Are you flexing it? You're talking about, is that the opposite of letter C?
Yes, sir. Kung extension po yung C, opposite po niya
Flexion
ay
siya.
flexion.
Okay.
Yes.
Flexion. Tama.
Tama. Sige ha. Okay, punta na tayo dito naman. Anong ginawa ni A?
Yung arrow po niya is
Extension.
towards sir,
Bakit
adduction.
extension?
Adduction,
A
adduction.
muna ha, si A.
Adduction, sir, adduction.
Adduction.
Kasi
Towards
papunta
the center.
sa'yo, towards the trunk.
Sir, adduction, AD.
Adduction.
Okay. What about letter B?
Sir, yan yung dorsiflexion.
Plan. Dorsiflexion.
Dorsiflexion. Okay. The letter C,
Bending.
Protraction.
protraction. Anong
Yes, sir,
kaibahan
kasi
ng
yung arrow
protraction
niya.
sa retraction?
Sir,
So, when
pag
you
yung
say-
arrow niya sa kabilang side, nire-retract.
So retract palikod.
Yes, sir. Pag protract papunta sa harap.
Yung mga ano dyan, mga ano to tawag? Bone, anong tawag? Bones, bone structure? Ano tawag sa inyo, Sir Mark? Bone
setting.
setters.
Bone
Yeah.
setter.
Alam na alam nyo to, no? Okay, anong ginawa ni letter C? Nag-protract ng shoulder niya or nag-retract?
Protract.
sir.
Protraction.
Okay, punta naman tayo sa letter D.
Depress.
Depression.
Depression.
Depression,
Bumaba bumaba.
Yes, sir. Depression.
Okay. So aralin niyo po yung ibang choices dyan ha. It's your responsibility. Usually ito yung mga common na ginagawa. Tapos na. Okay, maraming salamat sa lahat. Did you enjoy tonight's I hope you learned something. Next week, on Monday, wala po tayong Zoom sa 8 to 9. I'd like all of you to study the anatomy. So we still have three sets yet. Honestly, what do you think about our assessment? Did you learn something? Did you enjoy it? Lalo na yung mga
Yes.
nawala ang boses.
Nawala ang boses.
Kumusta? Mayroon na bang boses? Okay.
Wala pa rin boses, sir.
Wala pa rin.
Putol-putol eh.
Sa sarili mo. Okay. So, yon. Puyat yan. Okay.
Oo.
Saan na ba tayo? Okay, so far, do you like our anatomy? Yung anatomy na tinuturo natin, this is very practical, hindi siya boring. Kasi pag yung actual, parang hello, ang dami mong aralin na hindi mo naman nagagamit, no? So, I try to schedule everything in such a way that nagagamit nyo sa actual. Kasi yung meat naman natin ng ating practice is how to do needling. And this time, if you are from lab, you just don't say LI4, liver 3. You should always say Yuan Source point, Xi Cleft point. Okay, ganito ha. Let's give a challenge to our colleagues. Sabihin nyo, ano po itong bladder 40? How do you classify it? Pag walang sagot, they are not with us. Masama ba ugali natin? So, ibig sabihin, I'm so inspired kahit medyo but konting tiyaga na lang po. So, for module 1, we have like 4 sessions. And since super init ngayon, I'd like to apologize. We will have to continue with module 2. Ako kasi sa tingin ko, like yung mga practicum natin, we can reschedule that
kung hindi na masyadong mainit. Kasi siguro naman ayaw nyo naman ma-stroke yung nagtuturo, no? Kaya as much as possible. Grabe yung heat, no? So, siguro while siguro naman nagpa-practice na yung iba dyan, just be, you just have to trust the system because we're doing it in such a way that you will be like different from the rest, no? So, uubusin natin lahat ng points. We will still talk about Luo connecting points and Bakshu and Front Mu next week. And gusto ko kasi very precise yung location and you can mention their very important functions, no? And I believe that sa galing ng inyong sa galing ninyo sa anatomy, I'm sure most of you hindi na ito bago. So I'd like to congratulate you for that. However, for module 2, we will focus on something na hindi binibigyan ng attention ng iba. It will be all about diagnostics. Are you excited?
Yes, Doc.
Yes,
Lahat
Doc.
ng klaseng
Yes, Doc.
diagnosis aaralin nyo. And by that time, marunong na kayo mag-needle, so your edge would be yung galing nyo sa pag-diagnose sa tongue. Ako kasi naniniwala, hindi lang puro tongue and pulse. You have to really see the complete, you have to see the whole picture ng pasyente. Ang gusto ko kasi, like, the moment you see your patient, even if hindi mo pa nakikita yung patient, naririnig pa lang yung footsteps, you would already know what is the pattern. So that, ganon. And pagtingin mo pa lang, ay, tama pala ako. Kasi di ba there are people, they drag their feet. Meron naman iba ang bilis lumakad, di ba? Oh. And I'm sure pag meron kayong client na selfie ng selfie, alam nyo may imbalance na yun ng konti, no? Di ba? So that is the kind of training that we will teach you. Konting effort lang. Okay ba sa inyo? We will do this for 60 weeks. Si Sir Michael mukhang sumimangot. So, matatapos na natin yung module 1. Each module is composed of 10 weeks. No? From time to time, ang gusto ko kasi when we see each other for the practicum, ang dami nyo nang alam. So, na-observe ko, hindi na kayo pwedeng ibudol. Congratulations, Ma'am Ami, for pointing out that there's something wrong with the question. I sincerely apologize. Okay. Ang inisip ko pala puro answer. Okay. Sana minali ko yung isa, but anyway, so thank you for that. So that means you have a very discriminating eye, and I'm very proud of all of you. Okay, so anyone who would like to make a comment, sana hindi na po kayo inaantok. If you know, pasensya na po, we have to start early because I was anticipating a very long kasi pag sumobran tayo ng 2 hours, alam ko wala nang papasok sa utak natin, no? So thank you very much. I'm so inspired because you are all so good. Continue studying. So next week we will have anatomy again. Okay, we will still have anatomy, maybe 3 PowerPoints, and then we'll focus on Lu connecting and Bakshu and Front. Okay. Sir AK, are you happy? Are you more
Yes, Doc.
knowledgeable now?
Challenging yung next topic lalo. Medyo hindi ako familiar pa dyan eh. Mga sa anatomy.
Ay, oo nga pala. Okay, aralin mo yung anatomy, di ba? So nakinig ka naman sa mga sagot. Oo. Anyway, magkakaroon pa rin tayo niyan. Especially when we go to medyo boring kasi anatomy, but it's important. So I think nagustuhan niyo ba yung presentation ng anatomy?
Yes.
No, hindi siya boring, di ba? Parang mas siya. Kinuha ko lang siya somewhere. So, Filipino din yun. Ewan ko lang kung napansin niya. But I love the presentation.
So,
Madalas ko naririnig yun sa ano di ba? Sa mga point locations pag naghahanap tayo. Kaya very practical para sa acupuncture kasi siya yung laging basis.
So maraming salamat po. Thank you, Sir AK, for your comment. I cannot call on Sir Mark Anthony. Walang boses. Baka sisihin pa ako. Okay. Let's call on Ma'am Ami. Ma'am Ami, do you feel more inspired now?
Yes po. Lagi inspired.
Huwag niyo masyadong ibaliwalain yung theory. Napansin ko, yung 8 to 9 p.m., pag medyo group study na, wala nag-a-attend. No? Alam ko busy yung iba, pero okay lang. Ako kasi, I did that for my own, Kasi pangit kasi kung ikaw lang mag-isa mag-aaral, hindi ka mamamotivate. No?
Tama.
So, on Monday, wala po tayong Zoom. We have a board meeting with the PAAI. PAAI pala. Nagpapulit ni Sir Michael na nagtampo. But anyway, I'm also the head of the education department there. In fact, kanina we just had a lecture on muscle testing, which is very interesting by Dr. Randy Deliosa.
Gusto ko yan.
Oo. Magkakaroon po tayo ng face-to-face noon. We'll let you know. Gusto ko puro lang pag-attend. Muscle energy testing para malaman mo kung okay ba yung treatment mo. Super ganda. Hindi kayo nag-attend para kayo nag-boycott, no? So, kailangan pag meron ng practicum, I hope all the students that are with us will join it. It will be held at the PAI, so probably by June. And I also would like to request for depression kasi psychiatrist po kasi si Dr. Randy Deliosa. So, and he's also a celebrity, di ba? Nakikita niyo mukha niya sa social media. And I think we might be able to tap him very soon for our webinars. I don't know if he would agree. Kaya lang hindi yata papayag ng libre yon. Kaya I don't know. I hope he's not watching this one. Anyway, ano ba yun sasabihin ko? So yun, we'll keep you in touch. And next, we also have lectures on herbology introduction by Dr. Philip Tangatwe. That will be May 6, no? 2 Saturdays from now. Then yung chakra protocol by Dr. MacGerald Cueto. Yun, excited ba kayo? Mag-join na kayo ng PAI para medyo updated kayo sa mga lectures. So yun. Any questions? So let's ask who else pa? Sir Omer, did you learn anything today? Alam ko in-answer nyo. Medyo, I think you need to do something about your internet connection. Mukhang...
Apo sir, sorry po.
Oo, sige lang. Maayos din yan. And what else?
Able to participate.
Kunting tiyaga lang po, tingnan nyo. Nasa week 7 na tayo next week, di ba? Oh. So I'm going to turn off now the recording. Thank you very much, everyone. See you again next week.
Yes, Doc.
Maraming salamat din po.